Functional medicine focuses on identifying and addressing the root cause of disease rather than simply treating the symptoms, as each symptom or differential diagnosis may be one of many contributing to an individual's illness. So to discuss the role functional medicine plays in the prevention of developing Alzheimer's and dementia is Dr. Debbie Smith, who's an acupuncturist and homeopath. Welcome, Debbie. Good to have you here.
Thank you so much.
Now, Debbie, let's just get an overview of Alzheimer's. What exactly is it?
Alzheimer's is part of dementia that specifically affects your memory, your behavior, and your the way you interpret and learn things.
Okay.
And Alzheimer's specifically is where you've got these formations in your brain. It's called plaque formations. And what happens is it takes up space then, and then the neurons in your brain can't keep firing the way that it's supposed to fire, and that then affects your cognitive ability.
Right. So what are some of the symptoms or the presenting factors of Alzheimer's?
So the first one can really be very minimal. Where's my keys? And you ask that maybe too often, where's my keys? Then it can start being where suddenly, what's your name? But I know you. And then it can become a bit more serious where you can't learn new things. You might become very agitated. You lose your interest in your hobbies. And on the severe scale, it can be where people can actually even battle to swallow and they can't walk. So it's quite from no symptoms to severe symptoms. It's quite a wide variety of symptoms. And the most important thing to realize is the progression for most of Alzheimer's takes years.
Okay.
So ideally what you want to do is pick it up very early.
Right. How do you draw the line to say, right, this is now becoming a problem?
Well, I think what you look at is first, what's your family history like? If you now want to say, do I panic or do I not panic? You can do certain genetic testing to understand your predisposition for it. Plus, you can do biochemistry markers to understand what is happening.
Okay.
They say everyone over the age of 45 should do a cognitive score to see where they're at, because some things you might actually not realize. And on the score, one of the scores that they use is called a MOCA score, which looks at perception, it looks at clock drawing, it looks at memory and visualization and things like that. You can get a score on that, and that can kind of give you a little bit of an indication, okay, what is going on.
So what sort of percentage of the population does have or is likely to get Alzheimer's?
So likely to get is about 15%.
Okay.
It is significant.
Yes.
And again, some people will get it at an early age. Some people can even get it in their 40s.
Oh, wow. Okay.
And what we mostly know is people who are much older. So you're looking at 70s or 80s, but it can be early on as well.
Okay.
And as I mentioned before, the swallowing effect that it can have, it's actually the 6th leading cause of death in America.
My goodness, really?
It is more than breast cancer and prostate cancer combined.
Sure. There's a lot of discussion around diabetes type 3, which is associated as Alzheimer's or part of Alzheimer's. How does that relationship work?
So Alzheimer's, you get different subtypes that form it. So what we want to look at, we will look at what the precipitating factors is for someone. And believe it or not, there's about 37.
Okay.
Most people have between 10 and 20, so it's not an individualized thing. Now, where Alzheimer's type 3 comes from, or diabetes 3, one of the subtypes is called glycotoxicity.
Right.
And this is where you basically, your blood sugar isn't managed. Remember, your brain needs a lot of glucose to function.
Yeah.
And if you become insulin resistant, or the next step, diabetes, your brain cannot function the way it needs to function, and that starts to cause damage.
Okay.
And that's only one type. Another type is inflammatory, which is very common. When people are inflamed, you can pick that up by a blood test like CRP or interleukin 6. Another type is atrophic, and part of this is when your hormone levels start to drop.
Okay.
So a lot of women, if they have a hysterectomy and their ovaries are removed as well, they get that sudden
change in hormones.
yeah.
Yes.
And that can actually push them into nearly a dementia Alzheimer's state.
Fascinating.
But your hormones, including vitamin D, for example, you want all your hormones to be optimal in order for your brain to function well.
Okay. Now, how does functional medicine come into play in terms of managing Alzheimer's?
Again, we look at what is the reason for you. We treat the individual. As I mentioned, 37 reasons possibly you could have it. So what we want to do is find out what is the patient's specific reasons and treat that reason. So the first thing in functional medicine is we remove. So one of the subtypes that I haven't spoken about yet could be toxic. So toxic could be poisoning, it could be too much fungus or mycotoxins in the body. So you want to remove, or inflammatory, you want to remove what's causing part of the problem. Then you want to have the patient have some resilience. And this is if they, let's say, in a state of inflammation, you remove it. Now you make sure they're not inflamed. And then your last step that you want to do is rebuild.
Okay. What are the lifestyle things that people can do to give them a better chance of minimizing the impact if they do ultimately get it, or avoiding getting it even? Is it possible, if you are predisposed, to make enough changes that you can prevent it?
Well, your genes is only part of the story. So it's said that if you've got a certain gene, it's like the gun is loaded, but your lifestyle actually pulls the trigger.
Ah, okay.
So therefore your question is, can you do certain things? And yes, there is 4 main things that people can do. Number 1 is manage stress. It is so essential. Stress can actually shrink your hippocampus, and what happens is that's going to affect your learning ability.
Okay.
So whichever way stress management works for you. You want to make sure you sleep enough. That's the time your brain also helps to regenerate itself. They say 7 to 8 hours. Most people need that amount. But the most important thing about sleep is that a lot of people suffer from sleep apnea,
Yes.
and it's undiagnosed. So it means you're not getting enough oxygen into your brain when you're sleeping.
But
so
you don't know about it.
You don't know
Yeah,
about it.
Yeah.
So that's a very important factor to consider as well, which might be actually precipitating this whole condition.
Okay. And nutritionally, I mean, obviously a good diet is the start of any good life, but what should we really be focused on from a nutritional perspective to give us a fighting chance?
So some of the research that's coming out now talks about a ketogenic diet.
Right.
Because your brain either needs the glucose or fat. And as we know, glucose is maybe not the best thing to do because there's a lot of other side effects to it.
Yes.
So you want to provide your brain with good fats, and that is what the keto diet can provide for you.
Okay. And in general, are there things to avoid from a dietary perspective?
Anything that creates inflammation, so any refined foods, any sugar. A lot of people are also sensitive, not specifically to gluten, but to the pesticides, the organophosphates, and that affects their brain as well.
Okay. So Debbie, you mentioned 4 things. We've touched on stress, we've touched on sleep and nutrition. What would the last one be?
Exercise.
Ah, okay.
Very important, because what exercise does, it improves the blood flow in your body. It helps also with something called nitric oxide, which is essential for your brain to function.
Okay.
So some people, if they already got Alzheimer's, what they do is they actually train with oxygen, and that feeds their brain even more.
Ah, okay.
So there's quite a few different things you can do to improve your nitric oxide and help your body stay healthy, get the blood flow where it needs to be.
And would this be exercise that's sort of high impact, or would it be cardio, a mix of both strength and cardio? What's the best solution there?
Definitely a mix of both, for the reason that when you do weights, in males, but also in females, it increases testosterone,
Right.
which is very important for your brain function. And you burn more fat when you've got more muscle.
Okay.
So the combination is the key as well.
So Debbie, in terms of, you are a homeopath, are there herbal remedies and tinctures and things that are also useful?
Yes, there's definitely. Again, you want to treat the individual and find out what the problem is. The most common remedies to help for cognitive function could be things like bacopa, withania. It's also an adaptogen, so to help people adapt to stress.
Okay.
Supplements, DHA, that feeds the brain. So there is many things in our toolbox that we can use to help us, once we know what that subtype is, to treat that person specifically for what they need.
Okay.
There's some software programs now that you can sign up for, and they can actually track your progression,
Okay.
keep your brain active. Very important to keep learning new things, and that's where neuroplasticity comes in.
Yes.
So where your neurons can actually reconnect again, and by keeping your brain active, reading, the games, all of that, very essential.
Okay, fantastic. Well, Debbie, thank you so much. Lots of insight there. Some interesting thoughts to kind of take back and look at. Thank you for joining us.
Pleasure. Thank you for having me.